Back here, the government has decided not to force people travelling here from China to provide a negative pre-departure test, despite pressure from some epidemiologists. It comes as a new COVID-19 variant makes waves in the US, spreading twice as fast as other variants and increasing hospitalisations. Alexa Cook reports.
We might be in holiday mode, but COVID is still hard at work, mutating into new variants.
There's one in the USA, especially, that seems to be growing at quite an alarming rate. That's called XBB 1.5.
It accounts for at least 40% of current US cases. Epidemiologist Dr. Eric Feigl-Ding is labelling it as a super variant, which is among the most immunity-evasive escape variants to date.
Anywhere it goes, hospitalizations rise. We're very, very worried that, this could cause major problems in the next month or two.
While there's no evidence that it is more deadly, XBB.1.5 does have more mutations and is better at evading antibodies from vaccines and previous COVID infections.
It is taking all the other Omicron variants out, and we're displacing them at a rate we haven't seen since over a year ago.
Basically, we'd expect it to spread around the world and expect it to show up in Aotearoa.
Genome sequencing hasn't picked up the new variant here yet, but it could already be among us.
Given that we have flights every day from the USA, it's quite possible that it's already here.
Cases aren't just climbing in the US. China's seen a massive increase since lifting restrictions, resulting in many countries such as the US, UK, Canada and Australia demanding negative tests from Chinese travellers before departure. But not New Zealand.
We've made our own assessment of the risks to New Zealand. We've done that in a considered way. We don't see any basis for changing the policy in New Zealand.
Instead, government scientists will be testing the toilet water on international flights to detect the virus. And because China is failing to share its COVID data, health officials here will also email a random selection of travellers asking them to take a voluntary rat test.
It's essentially to fill an information gap and to get a sample.
But some here say that's not enough. There are calls for all passengers from all countries to be tested.
We should be doing that for everyone coming from overseas, frankly, because as we know, it's not just the strains that are evolving in China, it's kind of everywhere.
And although our daily average for cases has fallen by more than 1,000 in the past week, it's likely the real number is much higher.
Because many people are away, they're not going to be reporting and they're not going to be testing as much.
So while you're slip, slop, slapping and wrapping the sunnies, don't forget to test if symptomatic. Alexa Cook, Newshub.